I am Officer Donnelly Liebert Shiverton. Do you want to travel and don't have private transportation? Here are some travel safety tips to keep yourself and the persons around you safe from the coronavirus. When venturing out in public, it is recommended that you wear a mask at all times. Sanitize your hands before and after entering public transportation. The bus operators are also encouraged to sanitize their buses after each trip. Remember, always practice good respiratory hygiene. That means refraining from touching your face with unwashed hands. Always practice physical distancing. To maintain physical distance, the government of St. Kitts and Nevis stipulates that only 2 passengers are allowed per row. That is, 1 passenger on each end of the bus row, while 1 passenger is allowed to sit up front with the driver. This means that only 9 passengers are allowed in a passenger bus. Remember, stay safe, travel wisely as we work together to flatten the curve.
Is on.
Good afternoon and welcome to the National Emergency Operations Center COVID-19 briefing for today, the 1st of July, 2020. I am Les Roy Williams. We thank you very much for joining us for today's briefing. Of course, we continue to manage the COVID-19 pandemic here in St. Kitts and Nevis. As we are aware, the pandemic is not over. We are seeing a lot of flare-ups, a lot of spikes in several countries. It still continues to cause death globally and infection all across the world. Thank you for joining us. If you have tuned in via television or radio or social media, we thank you for being with us so that you can be provided with the most up-to-date information with respect to the COVID-19 pandemic as we continue to manage it here in St. Kitts and Nevis. There has been a video going around which was an erroneous news item put out by Telesur, which is a Latin American television channel that St. Kitts and Nevis had recorded 10 additional cases of COVID-19. That news item is false, and the channel, Telesur, has since apologized for that false report. There is absolutely no truth to it. Today I would like to invite the Director of Early Childhood Development Unit, Ms. Kimona Brown, to address us. Ms. Brown.
Pleasant afternoon to all. The Early Childhood Development Unit within the Ministry of Education is grateful for this opportunity to update the public about preparations to reopen early childhood centers within the Federation of St. Kitts and Nevis. This we have been exploring with a consciousness about the health, well-being, and care of the children uppermost in our minds. In this update, I will inform you of what the Ministry of Education, specifically the Early Childhood Development Unit, has been doing in response to the COVID-19 pandemic and how we have been working to secure the reopening of early childhood facilities. We are very much mindful of the request of parents for suitable early childhood care for their children so that they can resume work fully. We are also sensitive to the requests and economic challenges that have been experienced by the proprietors of private early childhood daycare facilities. What has been done? Prior to the closure of all learning institutions in March 2020, 85% of the workers in the early childhood sector were sensitized to COVID-19 and its impact on life and work. The impact of COVID-19 on education in general and early childhood in particular remain uppermost in the discourse and planning of education officials. The matter of reopening early childhood centers has been explored numerous times and in different settings within the Ministry of Education. The most recent explorations have been within the last week. A consultative meeting was held with the Minister of Education, senior officials of the Ministry of Education in St. Kitts and Nevis, the National COVID-19 Task Force, and representatives from the Early Childhood Development Unit. During this meeting, various concerns were shared from the position of public and private daycare child care service providers. The members of the COVID-19 Task Force also outlined the various concerns regarding limiting the possible spread of COVID-19 within early childhood facilities. They also outlined standards that are to be met for early childhood centers to be deemed suitable for reopening. The Ministry of Education, specifically the Early Childhood Development Unit, embraced the recommendations of the National Task Force and committed to taking the necessary steps towards educating proprietors and supervisors of early childhood care facilities of the necessities for securing compliance and subsequent approval for reopening. We have heard the National COVID-19 Task Force clearly when it advised of the following. 1. The reopening of the early childhood sector will be on a case-by-case basis. The proprietors of each facility would have to apply to the Early Childhood Development Unit to start the process and work towards being approved for reopening. 2. Proprietors and supervisors of nurseries and preschools are asked to contact the Early Childhood Development Unit at 466-2810 for guidance on the application process for the review of their facilities in light of the COVID-19 safety requirements. 3. Once an early childhood facility has been checked and determined to be compliant with the new safety and health protocols for the early childhood sector, then that nursery or center would be able to secure approval for reopening. As a consequence of that meeting with the COVID-19 task force, a follow-up meeting was held with key ministry officials to work towards concretizing the recommendations made by the COVID-19 task force in our quest to reopen the early childhood sector. We are well on our way in laying the foundation that can be of assistance to all our partners in the delivery of early childhood. What is ongoing? The Early Childhood Development Unit has committed to the following on the road to the reopening of the early childhood development sector. 1. Develop guidelines for the reopening of early childhood facilities that are relevant to staff, parents, and children. 2. Make centers accountable in attaining existing minimum standards and implementing the COVID-19 standards. 3. Determine and implement an application process for reopening of all early childhood centers. 4. Develop a sensitization plan for early childhood development staff on COVID-19 health and hygiene. Challenges. The early childhood development sector is faced with several challenges as a direct result of the impact of COVID-19. Some of these challenges include: 1. Children's lack of appropriate technology to access online learning opportunities while at home. 2. Children's inability to meet their nutritional needs at home due to their parents' reduced income. 3. Finding ways to address the social and emotional health of vulnerable children. These challenges can be addressed once we get the full support of all stakeholders in the public and private sectors. Therefore, we are making an urgent appeal for financial and in-kind assistance that can be of benefit to our most vulnerable within the early childhood sector. At the Early Childhood Development Unit, we remain grateful to the leadership of the Ministry of Education and the COVID-19 Task Force for the excellent work being done to ensure our federation's children's safety from the coronavirus and in support of their educational needs. The Early Childhood Development Unit will continue to play its part to ensure that it fulfills its mandate to provide a healthy learning environment for our children. We intend to take a proactive and informed approach towards the reopening of all early childhood development centers, and once centers have been determined to be compliant and given the approval for functioning, we will continue our usual monitoring. We cannot afford to compromise the health of any of our citizens with rash decision-making and hasty actions. We will continue to have extensive discussions with the experts and the COVID-19 task force in order to make the best decisions for all concerned. In closing, we thank the general public and proprietors of early childhood facilities for their understanding and concern during this challenging period. The Permanent Secretary in the Ministry of Education, Mr. William Hodge, and I are here to address any questions that you may have. Thank you for your attention.
Thank you very much, Ms. Brown, for your presentation. I now invite Mr. Melvin James, Director of the St. Kitts Department of Agriculture, to provide us with an update on agriculture.
Greetings all. It is my first meeting since the new Minister of Agriculture, so I would like to bring all our listeners and viewers greetings on his behalf. That is to say, the Honorable Alexis Jeffers, Minister with responsibility for agriculture. I wish to speak to you and to update you on where we are with our rain-fed agriculture. You may recall that some weeks ago we had started to sow some seedlings, but we were kind of like trying to figure out what would become of the weather. So let me show you that we were able to produce some 1,000 seedlings, distributed mostly, let's say, like between the districts around Keon and St. Peter's, over 300 trays. The greatest number really went to the Otley's Mansion area. These are our largest farmers and most progressive farmers, receiving over 400 trays. And then in between, the Sandy Point, Foy's area with a substantive quantity as well. As we move along, I show you that we held back on things like cabbages because in this very hot, dry period, we have a lot of damages from the diamondback moth. We also did not plant any carrots because of their sensitivity to moisture in these times. Sweet potato is great for these times, and we planted over 20 to 25 acres, about 2 acres of squash, 1.5 acres of melons, and in the region of 3.5 to 4 acres of sweet potato. You see here some images of the squash and sweet pepper in the nursery. We made sure that we had very robust, very vigorous, very healthy plants that we'd put out in the field, knowing that they would have some very adverse conditions. We had them holding for a while, so they're very hard. And as soon as it started raining in some districts, then we started to put them out. Now, so they're out there in the field, and we go to our next slide. And the other one after that, I will speak about the agronomy, the care of the crop. A lot of people in the Keon areas in particular have challenges with monkeys and pigs. But of course, we have a monkey control program. Many farmers know that there is a chat, and if you're not a part of that WhatsApp chat, as a crop farmer, you can be included. And here is where you'd make your pleas about damages from pigs and primates, and you will be assisted. But in addition to that, we need to have our farmers minded that things like sweet pepper, during these very hot times, sometimes come down with the kind of symptoms where the leaves are curled, the fruits are scratched, and it's because of mites. However, the program allows for treatment free of cost. The farmer simply needs to come to the department under the recommendation of the extension officer, and we have the pesticides that they can use, and they don't have to pay for them. So there's no need, we expect, for the crops to be disfigured. We expect that one will be able to see early invasion and deal with it. As it relates to squash, which is another hardy crop, which we're hoping to harvest, whiteflies is sometimes an issue, and we ask the farmers to be vigilant. Don't just look at the top leaf, but turn the leaves over, look at the bottom, and once you start seeing some little cream markings, cream deposits, or some actual white flies, some white creatures with wings, then begin to be concerned you have an infestation that is going to affect the total yield of the crop. But once we get through that, next slide, once we get through that, it brings us to the stage of marketing. We already have put in place a team that will engage the supermarkets and importers so that we're trying to make space in the marketplace for these produce. Sometimes people call in, they ask what kind of cost is incurred in this stimulus package, what have we done to date. I will just mention a few figures. As we have put the crop out there, we've had to do land preparation, and we've done over 70 odd acres right around the island at a cost of some $17,580. We've also had to buy seeds. We've engaged 2 private nurseries in seedling production. The seeds that we brought from overseas, of course, not just for the first planting, but anticipated over a period of time, has cost us some $449,000, and the seedlings themselves over $18,000. I hope you can read the table. But there's also work done in the livestock sector. Even as I speak, we brought in 2 containers of feed this Monday, and there's another 2 on the ground, so there are 4 this week, and to date they have cost us some $261,348.98 and still counting. I will just mention maybe 1 or 2 other prices. Overall, between crop, livestock, and fisheries, so far government has already spent some $4.9 million on the stimulus package. Let me now speak to you as I wrap up about some of the threats that we need to be concerned about this season. While I understand some farmers are anxious to plant, we also must be minded that it's the hurricane season. So in planting, we need to plant hardy crops, crops that are below the ground, root crops, or crops that are difficult to uproot by the wind, like pineapples. Depending on the location of your farm, windbreaks may be necessary to reduce the impact of the wind and to save the crop. Once you have to cultivate the soil, you need to cultivate the soil following contour farming, contour patterning, so that you always put in the banks perpendicular from the water flow, thereby preventing erosion and soil loss. In some cases, we might need to install drains, divergent ditches, and catchment areas so as to help to reduce the flow of the water and to channel it into the ground. If we're into more modern agriculture like shade houses, then we're going to need to take down the mesh, just leave up the bone structure, the basic chassis type structure, so that there will be less resistance to the wind and less damage. I shall continue to report to you as the crop progress. We will know where we're going. I will tell you what's happening on the front with our marketing. And of course, I end by reminding our consumers that we can do so much producing, but it must be marketed. We're depending on you. We promise we'll give you good quality produce. We promise we'll present it as best as possible at an affordable price. And we're asking that you will support local so that our investments will not go in vain, but we will advance our causes of feeding ourselves and satisfying our nutritious requirements. May it please you.
Mr. James, thank you very much for that update in regards to agriculture. I now invite Superintendent Cromwell Henry, Divisional Commander for District A, to update us on the law enforcement report. Superintendent. we would call on Superintendent Henry a little bit later. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center COVID-19 Situation Report. Dr. Laws.
A pleasant good afternoon to everyone, and thank you, Mr. Williams. So this afternoon, as per usual, I'm going to share with you the situation report from the Health Emergency Operating Center. And to date, the World Health Organization tells us that there are confirmed cases of COVID-19 on every continent save Antarctica. And I think over 218 countries globally are impacted. We are told that there are 10,357,662 confirmed cases. And if you look at the screen, you would see that's about 6 million more cases than the count stood on May 14, 2020. In terms of deaths, the total deaths globally, it's now over the 500,000 mark as at today, July the 1st. Now, what's happening in the Caribbean area? So to date, we have over 50,000 cases in the Caribbean region. And in terms of recoveries, it's quite positive. Almost half the number of recoveries. Specifically, there are 23,514 recoveries to date. In terms of the death toll in the Caribbean, and thankfully it's on the lower side, it's just 1,214. In St. Kitts and Nevis, as we are all aware, we've only had 15 cases and they've all recovered. So to date, as at today, July 1st, we do not have any active cases. We have 0 active cases. And it's over 70 days since we would have announced our last case. Now, in terms of testing, we continue to test individuals who are suspected cases, and we continue to test persons, nationals who would have come into country recently. So to date, we've tested 467 persons so far. In terms of quarantine, as I said before, nationals are, requesting permission to be repatriated home, and we are facilitating those requests. And to date, we have 64 persons in a government-designated quarantine site within the Federation. And between January to present, 852 persons would have exited quarantine. Okay, just for your information, there are approximately 4 government-designated quarantine sites within the Federation, 1 in Nevis and 3 in St. Kitts. As you are aware, we are utilizing the Ocean Terrace Inn, and then recently the Royal St. Kitts Hotel has come on board in terms of providing us rooms for quarantine, and there is also a Ministry of Health building in the Fort Lands area that is being utilized. In terms of the Haitian immigrants, thank you, Mr. Williams, for alluding to this at the beginning. And so last week, Monday, the Chief Immigration Officer would have shared that there were 13 Haitian immigrants who were found in St. Kitts. They are accommodated in a quarantine site, again, government site, and they have all been evaluated by the public health team. They've all received the first of their 2 COVID-19 tests, and all the test results from the first COVID test are negative. And so we do not have any new cases, and none of the Haitian immigrants have tested positive to date. Now, in terms of what's happening around us in the context of COVID-19, the New York Times tells us that there are 48,000 new COVID-19 cases were recorded across the entire United States on June 30th alone. And this is an increase of 80% in the past 2 weeks. And also of interest, the European Union began allowing entrance to visitors from outside the European Union today, but they've excluded most Americans as a result of what's happening in the USA in terms of, in the context of COVID-19. Now, CARPHA, the Caribbean Public Health Agency, in its latest situation report, tells us emphatically that the risk of further cases of COVID-19 occurring within the Caribbean region remains very high. And by extension, the risk of reimportation of the virus into the Federation remains high if and when we would reopen our borders. And so member states continue to lift in-country restrictions, and St. Kitts and Nevis is doing the same. And we are all aware that the gradual lifting of restrictions within our closed borders continue. As a matter of fact, we are basically back to normal in terms of church, businesses, etc. We just learned of the planned reopening of the early childhood sector. And so the gradual lifting of restrictions within our closed borders continue. In our last emergency powers regulations, we have allowed sports, all right? And so persons can now practice and train in terms of the various sporting disciplines. Now, the islands have allowed the repatriation of nationals, and I alluded to that just a few minutes ago. And some of our neighbors have reopened their borders. However, locally, we continue active surveillance. We continue monitoring our emergency room and our health, and within our health centers for any suspected cases of COVID-19. However, I need to emphasize that even though we are practically virus-free, we need to continue the prevention measures. Because when the virus is reintroduced into the Federation, it's not going to come with an announcement. All right? It's going to spread, and then there's going to be a time period X before we would have identified those cases that are affected. And then we're going to have to do contact tracing. And it's these prevention measures that's going to save us. And these include the physical distancing that we keep speaking about. In other words, we all have a personal responsibility, personal and collective responsibility, to maintain a distance of at least 3 feet between ourselves and others, and by extension, social distancing. And so we also have a responsibility. If you know of a function taking place and you show up and it's a large crowd of 100, 200, 300 persons, and nobody is adhering to physical distancing, there isn't much space between persons, it's your responsibility to walk away and go back home, because that's how you are going to prevent and reduce your risk of exposure to the virus. Let me repeat. When the virus is reintroduced into the Federation, it's not going to come with an announcement. It's going to show up, It's going to infect persons. The persons are going to come down with the symptoms. And then it will be too late because that individual would have already interacted with other persons. And so we need to be very aware of this and be responsible in terms of maintaining the required distance between ourselves and others. So just in case the virus is reintroduced, we are protected. Hand hygiene remains the best defense against the SARS-CoV virus. Hand hygiene, very, very important. Washing your hands after touching high-touch surfaces. Keeping your hands out of your face, nose, and eyes. Yeah, that's very, very important. And the wearing of masks while in the public space. These are the non-pharmacological measures that are going to protect us as we continue through this COVID-19 pandemic. And this slide just highlights the importance of wearing the mask while in public. Because if you're in a setting whereby it's virtually impossible to maintain a 3 to 6 feet between yourselves and others, your wearing the mask is a means of protecting you and reducing your risk of exposure to the virus. And so, again, this is just a gentle reminder, despite what you may be seeing around you, please adhere to these measures. Physical distancing, 3 to 6 feet between yourselves and others. Social distancing, try and avoid crowds and mass gatherings, irrespective of, the information and the invitations that you would receive. And hand hygiene, very, very important, and the wearing of the mask. I may sound repetitious, but I am pleading with you. Please adhere to these measures because this is what we have. We are still in search of the appropriate pharmaceutical interventions to treat COVID-19. The scientists are still in search of that vaccine to prevent us as a means of prevention against COVID-19. So please, let's be responsible and adhere to the measures that we keep telling you about. Thank you.
Thank you very much, Dr. Laws, our Chief Medical Officer. I now invite Superintendent Cromwell Henry, Divisional Commander for District A, to give us his report. Superintendent.
Thank you, Mr. Williams, and a pleasant good afternoon to all viewing or listening to this broadcast. New regulations number 27 of 2020 have been published, and these regulations commenced on June 27th and will run or will be in effect until July 25th. The promised easing of restrictions has been realized in these regulations, and I would give some of the restrictions that has been eased since our last regulation prior to this one. There is no time limit on access to beaches. However, there shall be no picnics, beach parties, or other social gatherings on the beaches. Passenger buses and ferries can now carry their maximum capacity, but masks must be worn, windows must be kept open, and hygiene and sanitization protocols observed. Training and practice sessions are permitted for amateur and recreational sporting events, but all hand hygiene, sanitization, wearing of masks, and physical distancing protocols in the regulations must be observed. 6 members of the same family can now sit together at a table in a restaurant. Previously, it was limited to 4. Weddings and funerals can now host the maximum number of persons the venue can accommodate. It was 10, then it went to 25. Now it is not limited, but only limited by the capacity of the venue, while observing physical distancing. A space of 30 square feet per person is recommended in the regulations. There was some improvement on the Frigate Bay Strip last weekend, in that there was not the widespread party atmosphere with the DJs and their hi-fi systems. We thank the bar owners for their cooperation in this regard. However, we want to remind you that while the bars and restaurants are permitted to operate, social and physical distancing are still key components of their condition to operate under the regulations. Regulation 16.3 provides that where it is not possible for a business to function in accordance with the provisions of Regulation 7 relating to social and physical distancing, that business shall cease to operate for the duration of the regulations. So this is one of the consequences if you cannot adhere to the protocols. The regulations require restaurants to close at 10 p.m. However, Regulation 16.10 requires all businesses and enterprises to ensure that opening and closing hours allow sufficient time for all personnel to adhere to the hours set for night curfew, which is at 12 midnight. Given the crowd size at bars and the distances persons have to travel to get home, the police have recommended 10 p.m. as a reasonable closing time for bars as well. Therefore, the police will be enforcing this time, and we ask that bar owners take note. Speaking of bar owners, the police and the COVID task force will meet with the bar owners on the Frigate Bay Strip at 3 p.m. tomorrow, July 2nd, at the Timothy Beach Resort. Important matters relative to your operation will be discussed, and we hope that all interested parties will attend this very important meeting. The remaining opening of your bar depends, your presence at this meeting depends on whether or not your bar remain open. So we really invite you to come. I want to thank you for listening, and pleasant good evening.
Thank you very much, Superintendent Henry. I now invite Mr. Abdias Samuel, the chair of the COVID-19 National Task Force, to give us his report. Mr. Samuel.
Pleasant good afternoon to all. Thank you, Mr. Williams, and to our listeners, viewers, wherever you are. Today we continue with our updates, and again, I want to thank you for your continued support in this regard. So, I continue with my theme. We want to be the first to be last and the last to be first. And today I want to focus on compliance versus non-compliance. Now we have, as Superintendent Henry just said, we have regulations in place, and these regulations go down until the 25th of July, I think it is. And we want persons to adhere, and Dr. Laws, I will not repeat myself, emphasize the need for us to engrave these protocols into our daily lives. Our borders have to open at some time, but I can assure you that we are going to do it slow and methodical and very comprehensively. One of the things in our discussions yesterday is that we don't want to be like a seesaw, close and open, open and close, close and open, open and close. We want to ensure that the system and infrastructure that we put in place is a framework that will stand up and will be resilient to the impact of COVID-19. So therefore, you have to play your part. You have to ensure that as citizens, as good civil citizens that you are, that you own up to your responsibility and help us. We're looking at compliance versus non-compliance. What is satisfactory compliance? We're looking at practicing good hand hygiene, the availability of sanitizing agents, sanitizers, 60% alcohol thereabout, And what we have readily available all around is the always reliable soap and water. That is something that is around. So listen, I think my hands have changed over the past 6 months practicing these things, washing my hands, using sanitizers. I actually walk with one in my vehicle all the time. Throughout the workplace, we have them all throughout to ensure that we continue, because again, these are the measures that are going to help us remain resilient when the virus returns. And then, why the emergency powers? The emergency powers are there to guide, to ensure that we practice what we need in order for us to remain where we are. Just imagine that we are over 70 days without the virus, and this is why you can actually enjoy the successes that has been gained because of the sacrifices that you as the citizens have made, and also the hard-working people. So we look at what the regulation says is the same thing, the 6 feet apart, the number of persons in a particular area, the distancing markers. And one of the things in walking through a number of business places is that these markers, they're going to be worn over time, especially if you're just using tape, if you're using paint. And what I am simply asking you to just redo them over and over. Just highlight them over and over so that persons could actually stand 6 feet apart. That's all we are asking of you. It's regulation, it's law. It's easier to do that than have to be fined $5,000 or 6 months imprisonment, or both. It's best. I prefer to just buy a roll of duct tape and go around and mark my 6 feet and ensure that I am in compliance with the regulation. It's simple. So, my good dear citizens, the business sector, again, I am calling on the Chamber of Industry and Commerce, who has been a good partner in this regard, to continue to champion in the cause of the business sector in particular, to continue to carry out these measures. And again, we're going to go to the topic of the mask and do's and don'ts. Look at the slide, and you will see some of the do's and don'ts, how you wear a mask. Yes, we are being given the persons complain often about the mask, but guess what? If you look at the news, I was looking at the CDC, the director for the CDC, and he was emphasizing about the use of mask. I was listening to the news this morning and before I left for work, and the major emphasis right now in the United States is face covering. Covering your nose, covering your mouth, in order to help curb the transmission of the virus. So all I'm asking our citizens to continue to do the good things that you did in the beginning. Yes, we have relaxed some of the regulations, but that is to have a balance of economic activity and some freedom for you, and also managing the virus itself. So if we have this triangulated approach, you have to do your part. We cannot do it all alone. So therefore, do the good practices, and you will see we will get over this pandemic. Good. All right. We spoke about some of these challenges with satisfactory compliance, adhering to all these measures. But I'm saying again, in particular, the bus operators that get called every day. I process approximately 200 calls daily. And 25% of these calls are persons complaining about the bus drivers. We have had discussions with the associations. They have assured us that they're going to do their best to ensure that their members and the bus drivers, public transport on a whole, wear the mask. I was speaking just yesterday morning with an operator for the ferry, and that was his challenge, where persons are actually threatening him when he's asking them to please wear your mask. Please wear your mask. I don't want us to reach that scale of negligence and ignorance. I think we are a better society than that. One of the sectors I want to highlight with you is the manufacturing sector. And this I want to share with you for you to see the number of persons that we have worked diligently with this sector to get back out to work. If you look at, we have Jaro Electronics Limited, Cajola Cristado, API Harrosover, we have the Carry Brewery, Electrofab, Sinkis Brushes, the Marara Distillers, Sun Island Clothing. So a total of 1,047 individuals or persons are working in this sector, and a total of 785 of these workers are actually presently working. And I must commend this sector for doing what they needed to do in order to become compliant. And I really want to thank the task force for going above and beyond to ensure we get people back out to work safely. And that is what I want to emphasize, safely. And therefore, we have 262 persons who are still at home. And I am informed that by Jaro that they soon will have a building ready for the task force to inspect. And we expect at least 115 persons out of the 262 to return to work. And I think that is commendable. I'm hoping that at least by the end of August into September, we can actually have everybody back at work. The task force has been busy engaging in a number of meetings. We have been holding meetings with the Ministry of Tourism, UHMS, and also within the group itself, meaning that the task force meets every Tuesday afternoon, and we look at the requests that are made of the task force, in particular business places. We look at the request for repatriation. Yesterday, the task force looked at over 35 requests for repatriation, totaling a number of over 55 persons who are desirous of returning to the Federation. And at this point in time, I wish to acknowledge the Royal St. Kitts Hotel, Mr. John Zuliani, the president. Even though he's overseas at the moment, he has been kept in touch, and we have been dialoguing frequently so that we can utilize his property or their property as a quarantine site for incoming travelers. And I also want to acknowledge Mr. Darren Thompson, General Manager, for the great work that he did in assisting with the processes and procedures that we wanted to put in place, and ensuring that they are done, and also preparing his staff. If you realize that in Antigua, recently, 4 staff within a hotel actually tested positive for COVID-19. So we want to make sure that everyone is safe. I want to now switch to the update for the hurricane season. The hurricane tip today. I want to speak about business continuity, and that is important. When we listen to business continuity, persons think that business continuity is just for the business sector, but it also applies to you personally. How soon can you recover? How soon can you get your household back up and running or functioning after we are impacted by a tropical storm or we are impacted by a hurricane? And this comes down to planning, having a good recovery process, management, and ongoing operations. What that means, identifying the risks from the impact of a tropical storm, hurricane, building resilience through implementing mitigative measures, and also the procedures that you use to reach here. So, the first thing is that you have to develop that plan. And if you develop a plan is basically non-usable or non-functional if you're going to have a plan and nobody knows about it. So you need to train your people as to, or expose them to the plan so they know what the plan requires. One of the things in your plan you have to do is to ensure that there's protection for your staff or your family, and also for your management team and yourself. That is very critical. I won't go through every single thing because it's on the screen, as you can see. And it's important for you to take note of some of these things that we are asking you to do so that you can develop that policy. You can develop that plan for your home and also for the business place. Resiliency comes from putting these structures in place. So if we are impacted or affected, we can actually begin operation as quick as or as soon as possible. Thank you very much for listening, and we now look forward to you for your questions. And we also, tomorrow, I think we will be having some meetings with some tour operators. That's the seaside tour operators. And we will also be having meetings with the National Carnival Committee. And lastly, with the bar operators and the strip. And as Superintendent Henry said, it's very important that you attend. And next week, we should be engaging the Chamber of Industry and Commerce for some further discussion, and also the Christian Council and Evangelical Associations. So the task force have a busy week ahead in terms of engaging with our various stakeholders. Thank you.
Thank you very much, Mr. Samuel, for your report. We now come to the segment of question and answers. The first question goes to Dr. Wilkinson. Dr. Wilkinson, I am a taxi driver and my wife works in the hotel industry. We have been suffering financially because of the closed borders and shutdown of tourism. We may survive the virus, but I don't know how much longer we can survive on our current budget. When are you and the Chief Medical Officer going to advise about opening our borders so we can get back to work? Dr. Wilkinson.
I'm just going to refer to a few notes that I have here in answering that question. I think it's a pertinent question. There are a number of persons who are suffering economically because of the measures that we have had to put in place to contain the virus. And there are some persons who ask every day or say that they might survive the virus, but they might not survive the financial hardships that they are experiencing. I just want to remind us about a few facts, and the CMO mentioned some of them in her presentation. This month makes 6 months since the virus was introduced into the global population. And over those 6 months, we've had 10 million cases and over 500,000 deaths. There are a lot of countries that are still going through their first wave. There are a lot of states in the United States that are still going through their first wave. And there are some countries who, although they successfully contained the first wave, they're seeing a resurgence, especially countries that are open their borders, or even states within the United States that open their borders, and some may say prematurely. Most people are still very susceptible to the virus, and we are not anywhere close to the end of this pandemic. As a matter of fact, if you listen again to the figures that the CMO spoke about, the pandemic is actually speeding up globally. Now, we have repeatedly said that the World Health Organization advised that countries, in addition to containing the virus, they also have to take into consideration the economic and social impact that these containment measures have on the country. When we closed our borders, I think it was in February, we closed it for health reasons to contain the virus. And if we are to make a decision solely on health reasons to open up our borders, it will not be anytime soon, because without an effective vaccine and with the virus speeding up globally, our population would be exposed to the virus and we would have some ill effects. Now, if you follow the news or the literature, the earliest that we can see a vaccine coming on board. It may be January. And it doesn't mean that as soon as the vaccine comes on board, that persons can be immunized and borders can be open and people move freely, because it will take several months to have a sufficient number of the population immunized and become immune so that persons can move around freely. And so if we were to make a decision to open the borders based on health reasons only, we would not be advising to have the borders open for several months to come. Now, a number of countries have made a reason, have opened their borders for economic reasons, and I believe in the not too distant future, we would have to make that type of decision. And so the decision to close the border was a medical one, but the decision to open the border would not solely be a medical one. We'll have to make a balance between the medical reason and the economic survival of the country. So it just doesn't rest in the hands of myself and the CMO. So the question asking when myself and the CMO are going to advise the government to open the borders, it would not be just based on medical reasons. However, whenever the borders are open, the virus would be reintroduced inevitably. And so we cannot continue to sing the song that we are virus-free, because we are not going to remain virus-free forever. What we need to do is to learn how to live with this virus. And what we've done over the last 6 months is to reinforce the non-pharmaceutical measures that we need to take into consideration to contain this virus, because the virus cannot move from this point to that point without your help. And so once you do the social distancing, wearing your mask, hand sanitizing, etc., we will learn to live with this virus, and we'll be able to suppress the spread of the virus so that when the borders are open, we would not have any clusters or community spread, and we would not have our healthcare system being overwhelmed. And so the decision to open the borders also lies in your hands and how responsible you choose to be over the next several weeks. Thank you.
Thank you, Dr. Wilkinson. The next question is, can any of the medical experts tell us more about this new virus in China that threatens to cause another pandemic? We would have Dr. Wilkinson again.
Yes, you would have heard recently about a new virus that was discovered in China in pigs. And this is a virus that is similar to the H1N1 virus that caused the swine flu pandemic in 2009. And it has been labeled the G4 virus. Now, how this was discovered by them doing surveillance in pigs and pig workers between, I think, is 2016 to 2018, and in doing nasal swabs of these pigs, they discovered this virus. Now, there's no reason to panic, however, because all that is present in the pigs, and they found that some humans in certain provinces working with pigs have been infected. There is no evidence as yet for human-to-human transmission, and all that has been shown to replicate rapidly in the nasal cavities of the humans who were infected. As I said, there is no evidence of human-to-human transmission, and so thankfully they have discovered it, and hopefully they will be able to contain it, and we may not see a second pandemic coming around. Thank you.
We certainly can't handle a second pandemic at this point. This question is for the Director of Agriculture. Can you provide an update on Farmers ID?
There has been quite some discussion and inquiries about Farmers ID. So, caller, inquirer, thank you. is very current, and I do hope we have quite a number of persons who are with us. There has been a pause on the issuance of ID, not so much from the department's point of view. The IDs have to come to us, and then we pass them out. Those persons printing the IDs, they've had some challenges, and I think it is similar because of the COVID, the number of flights coming in with the material for that processing has been significantly delayed, just like how a lot of regular cargo has been put on hold. And I think that is the challenge there. I have been informed that quite recently, a lot of the items that we were waiting on, they have or are about to arrive. So I think going forward, maybe by perhaps next week, that matter should be resolved. So hopefully we'll be able to issue IDs shortly. I'll say as well, the department, we met about a few days ago, and we're also looking at updating our IDs and adding additional information to them. That will not prevent us from giving out those that we have, but just to say in the near future, we are going to be doing some additional work, and we may recall those that we have and issue some others. So stay in tune, and we will see how best we can assist you. I hope you have been well informed. Thank you.
This next question is also for Mr. James. Is there a document that farmers can produce at departments and businesses to access farmers' discounts?
I'll have to make my own interpretation because I'm not so clear. How does one get a farmer's discount, perhaps? We say that if you are in possession of a farmer's ID, you will pay less than if you don't have a farmer's ID. If that's what you mean. So it's not a document per se. If someone is engaged in a certain level of activity, then I ask the extension officers to make an assessment. For example, if you're raising pigs, I don't recall exactly, but we might say if you have 5 sows, 5 female pigs, and then a number of young ones, then you can qualify for an ID. If you have less than that, no. So for each species, cattle, sheep, goat, there are parameters. Similarly, crop farming, there are parameters. So once you qualify, you'll get an ID, and you'll pay less once you do business with us. Similarly, once you qualify, you can also ask government through us for duty concessions. So that is how it goes. But whether that is all contained in a document, not really, if that's what you mean.
I think that this question was addressed earlier, but I'll ask it nonetheless. What social distancing and mask wearing standards apply to the opening of bars and restaurants, and to what extent are these being enforced? Superintendent.
Thank you for that question. I will just read what the regulation speaks to with respect to bars. Regulation 16 10. So let me get it right. Regulation 16, Sub-Regulation 14. During a day of limited operation, bars may be open for the purpose of, for the sale of liquor in accordance with the Liquor Act, and it gives some conditions under which they can operate, and it says all persons shall adhere to social distancing and physical distancing protocols. All persons shall adhere to hygiene protocols pursuant to Regulation 14, and no more than 4 members of the same household shall be in close proximity to each other, and no more than 2 persons who are not from the same household shall be grouped together or share a table. The spacing between tables and at the bar or other seating arrangements shall allow for a minimum of 6 feet between persons, and all persons shall wear a face mask covering their nose and mouth in accordance with this regulation. You asked to what extent it's being enforced. That is the reason why we are having a meeting tomorrow with these persons to basically read the riot act to them, and thereafter we will see what happens. Thank you.
Someone is asking, when does Caribbean cinemas open? And can the task force provide any insight on this? I realize that people had a sort of a drive-in movie over at Frigate Bay on the weekend. But this person wants to know if Caribbean cinemas will be open anytime soon.
All right, so based on the information I have, a request was made by Caribbean Cinemas for the National COVID-19 Task Force to visit and look at what steps they have taken in terms of their readiness for opening. And if I'm not mistaken, that visit will take place either tomorrow or Friday. And so, a date, will probably be announced after that. Thank you.
Okay, that brings us to the end of our question and answer segment. I thank you very much for providing your questions, and I do hope that they were adequately answered. If not, you can always pose a follow-up question at our briefing next week, Wednesday, at 5 p.m. I do want to thank those who participated today in today's briefing. The Director of Early Childhood Development Unit, Ms. Kimona Brown, we thank you for your presentation on the stage you're at with respect to the reopening of early childhood development centers. I also thank Mr. Melvin James, Director of the St. Kitts Department of Agriculture, for his update on the agricultural sector. Superintendent Cromwell Henry, Divisional Commander for District A, for his update on the emergency powers COVID-19 regulations. We also thank Chief Medical Officer Dr. Hazel Laws for her COVID-19 situation report and other health tips. And we thank Mr. Abdia Samuel, Chair of the COVID-19 National Task Force, for his presentation. We also thank Mrs. Christmas Jacobs for her dedicated service of sign language that she continues to render so effortlessly. We thank Dr. Cameron Wilkinson, who continues to be here and to provide answers to questions that are asked, very important questions, our medical chief of staff at the Joseph N. France General Hospital. We also thank our permanent secretary, who is present here today to support, of course, Ms. Kimona Brown, the Director of the Early Childhood Development, Mr. William Hodge. Thank you very much. We thank the media for continuing to partner with us in providing information with respect to the management of the COVID-19 pandemic here in St. Kitts and Nevis. It is very important that information, accurate information, is provided to the public. We don't want inaccuracies in reporting. Thank you very much to all of you who joined us today for today's briefing. Next week, we will be back with another NEOC COVID-19 briefing on Wednesday at 5 p.m. We will see you then. Until then, continue to observe all the protocols that have been implemented for your security, for your safety, for your health. I am Les Roy Williams. Take care.
Is on.